My name is Dr. Andrea Piotrowski, and I'm a clinical psychologist in the Department of Clinical Health Psychology at the Health Sciences Centre in Winnipeg, Manitoba. Currently, I'm the chair of the Practice Directorate through the Canadian Psychological Association, and also the chair of the Council of Professional Associations of Psychologists, and I'm past president of the Manitoba Psychological Society. Along with CPA, the Practice Directorate ended up hiring a marketing firm, and with this we wanted to see what are Canadians' perceptions of psychologists and the practice of psychology. And to our great pleasure, Canadians like psychologists, and they think that psychologists provide an excellent service in various areas of mental health and also behavioral change and physical health. But in general, they want access to psychologists, and the number one barrier that they're saying they have is cost. And although some people do have insurance coverage to cover private practitioners, oftentimes it might be limited. So then you might turn to the public system and trying to see a psychologist within that system, which is incredibly important. However, when you have wait lists that are months and months long, the public might not be able to access psychologists. And so those who are fortunate enough to see the private practitioners, great, but those that aren't, what are their options? And so this is one of the reasons that we're really pushing the government to hire more psychologists within the public system so that the public does have access to psychologists, because access to a psychologist should be a right and not a privilege.
I'm Chris Somerville, and I'm the Executive Director of the Manitoba Schizophrenia Society. I've been in that role for 17 years, actually the longest serving Executive Director among the schizophrenia societies across Canada. As well, for the last 7 years, I've been the CEO of the Schizophrenia Society of Canada. And going on 6 years, a board member of the Mental Health Commission of Canada. In terms of whether Manitobans and Canadians can access psychological services, I probably wouldn't be doing this interview if they could. So obviously they can't. The Manitoba Center for Health Policy has, in one of their reports a couple of years ago, indicated that, yeah, if you're wealthy, you can have access. But unfortunately, because most of us are not wealthy, and because psychology and psychological support services are not covered under Medicare, millions of Canadians go without the appropriate supports of psychological services.
My current position, I have two positions actually. One is the Professional Practice Leader for Psychology for Vancouver Coastal Health, and I'm also the Director of Clinical Training for our pre-doctoral residency program. Kind of interesting from my perspective. I don't think we actually plan ahead that far to say I'm going to be the practice leader of a region when we start off in our career. However, what the recent events that led to this particular position as practice leader for Vancouver Coastal was related to the fact that Coastal has not had a practice leader for about 12 years. So psychology had actually been bereft of leadership in that regard. So lack of advocacy, no head of the discipline to be at the table with other professionals to meet the needs of patients and to advocate for psychology. So I was working in other areas, and in fact, I had been in Vancouver for quite some time and then moved to Alberta, where I got a sense of, wow, there's very strong leadership here in Alberta. They had a practice leader for 25 years, and the health region's very exciting to work there, very organized, lots of advocacy, lots of collegiality, an incredible amount of collaboration and leadership in psychology, and very, very strong and well respected. I came back to Vancouver and I noticed, gee, we don't have that. A very, very different culture here, which got me, I think, excited about promoting psychology, getting passionate about letting people know that we do add value. What is it that we do? On many, many levels, people don't know what we do. And so that makes it difficult for a group of experts with PhDs to do their job. We have to educate others. I responded to an actual ad from Vancouver Coastal when they were looking for a practice leader. And I thought, well, that's interesting. I wonder if I can do that. And my first response is probably not. I don't know what that is. I've had a practice leader. So anyway, I answered the ad, and this was put out by Psychology, and also Laura Case, who's the Director of Mental Health and Addictions for Vancouver Coastal Health, who said, you know, you really need a practice leader here. Why doesn't Psychology have one? And she's very much get the job done person. She has great vision and makes other people accountable as well. So I applied for that job, and for one reason or another, they thought that I could do that, so I'm privileged to be here. And that's kind of how I landed in coastal health. And when I got here, it was basically looking at the landscape, and I think that's one of the first things that I did when I got here, looking at developing relationships. Laura Case has been an incredible ally. Last year, we took the opportunity to create a regional conference, which hasn't happened in 12 years here in the region. So Psychology put together a regional conference. We invited all of the disciplines, social work, OTs, rec therapy, nurses, medicine, and basically it was a celebration of partnerships on what we all do to assist in the wellness of our patients. We also tapped onto that some areas that we felt were needed in the region, like shared care. So part of that was seizing an opportunity or creating an opportunity to say, here is a group of experts. We can provide services and assistance to places and areas that haven't been well represented in the past. So we created also a special session on shared primary care. We invited people up from Calgary, experts and specialists there, Dennis Push and Bob Acton, Margaret Okender, who's the head of psychiatry services for shared care, Paul Ragusa, who's their manager, and they flew out from Calgary and they did a special presentation for us on shared care and how psychologists can integrate into primary care offices. Much needed. Physicians came, psychiatry came, the Ministry of Health came, directors from both health regions, Fraser Health and Vancouver Coastal, and we had a very, very good conversation and discourse about how we can assist patients in that primary care level, where we have experts and psychologists diagnosing, assessing, providing people with the right treatments and giving those right treatments to the right people. So how can you use our expertise, basically, and how can we add value? Went over very well, and so well that right now we're working on a pilot project to include psychology in primary care at this moment. One thing I think that's important to add is the need to train psychologists to be able to work with others by demonstrating how we add value. And I alluded to that earlier, that I think part of the things that it's almost, I wouldn't say dismay, but a concern that after all the years of training that we actually have in 12 years, that we're kind of unprepared to do the kind of networking that I've been talking about. That marketing, that networking, going to managers. One of the things that I did when I started working here, which was to meet every single manager and every director and sit down and get a place at the table. Some people say if we're not at the table, we're on the menu, and that may be true for, I think, most health regions. But remarkably, it's something that we're not trained to do in those 12 or 10 years of education that we have. And it's really quite crucial whether you're in a health system, a coastal health system, institutional system, or whether we're even in private practice. We need to know how to do that networking. And I think that's something that we all really need to focus on a little bit. I just reminded of the seminar that we just did today for our psychology residents. We actually talked about that. We actually had a seminar on marketing and networking and how we add value. And they just ate it up. And they said, wow, we don't get trained to do this because we're going to be finished in another 6 months, and then what do we do? So part of this, apart from all the knowledge and the skills that people have in research and assessment and diagnosis, we're not actually telling them how to be productive and successful in other areas. So I think that's really, really important. It's the need for us all to work together collaboratively that way. So I'm thinking, what does it take what are the characteristics for psychologists to be effective in advocacy? I've mentioned quite a few. I think that openness, building relationships, building rapport, taking leadership roles, be leaders, do what you do well, look at your strengths, and then share that with others. Be open to other people's experiences and collaborate, create partnerships. Be excited by what you do, be proud of it. I'm proud of what we've accomplished in the last year by creating 8 new psychology positions in the region, where previously when I got here there was quite a bit of demoralization going on and we were actually worried about our jobs. So there's a shift, and part of that is because maybe I've tasked all of psychology to get out there and ask people, what is it that you want and how can I help you? How can we add value? We're experts, let people know about it and be passionate about what you do. And I think that's what's really important. I would just ask you to get out there and seize those opportunities or create them. Call me, collaborate with me, collaborate with all of your colleagues across Canada, and enjoy it. And thanks for this opportunity to chat.
When I was president of the Manitoba Psychological Society, one of the key areas that I really wanted to push is the integration of psychology into primary care. This is an innovative initiative that's been occurring across the country, including in Manitoba. We ended up having meetings with executive directors of primary care and of mental health. And we really wanted to continue to build that and have meetings with the Minister of Health and Healthy Living. Sometimes you have to call in the heavy hitters. And so at one particular time when Dr. Karen Cohen was in town for the Mental Health Summit, we were more easily able to schedule a meeting with the Minister of Healthy Living because she was in town. And so she was able to speak on behalf of psychology from the national perspective, which was incredibly powerful. Given the push towards the integration of psychology into primary care, we also invited Dr. Jean Grenier, who's a clinical psychologist, and Dr. Marie-Hélène Chaumienne, who's a family physician, both of whom are from Ottawa and do research and practice in primary care. And we were able to schedule a meeting with the Deputy Minister of Health, as well as Assistant Deputy Ministers of Primary Care and Work, and Executive Directors in Primary Care and Mental Health. This particular meeting was really a key turning point. The government was able to hear, particularly from the family physician, a group that has a lot of power, at how incredibly helpful it was to be working with psychologists and what they have to offer the community and to offer family physicians as well. A couple weeks after that meeting, I ended up getting a phone call from government with the ask of whether we would be interested in putting together a partnership grant to CIHR with the government. And at that point, I thought they finally listened and they finally heard us and how we can actually work together. We ended up putting this grant together along with many colleagues in psychology. And at the end of February of 2013, we found out that we actually got the CIHR planning grant. And it's more about the actual relationships that we forged during this process, less about the money, because what this means is we're going to already have established meetings with government occurring over the next year, and then we're going to be applying for a larger grant, which will hopefully increase the number of psychologists within primary care, and the government will end up seeing that psychologists have a role, and we've been called to action and we've responded.
Well, an effective advocate is a person who has a passion about a cause, and you want to affect change, and you have to have that real belief that you can affect change with government or to whomever you are talking to, and you are making a compelling case so as to affect that change. And I think some of the other characteristics of an effective advocate is that they have to be credible, they have to know the issues, position their issues very well, they have to have their evidence, know their facts, and probably at the heart of successful advocacy is an impeccable relationship with politicians and government officials. I think as much awareness and public education that we all can do in terms of what psychology is, the role of psychology, the value of psychology, demythologize any aspects of psychology, and help people to understand that it is an effective therapeutic means of helping people to gain or maintain wellness and resiliency. That would be important. And added to that also would be the fact that we need to advocate for more salaried psychologists as well as psychological support services being covered by Medicare. So someone might ask the question why psychologists should be engaged in advocacy. Well, I have this little saying, and that is, if you're not engaged, you have no say. And also, you want to keep your agenda on the radar of the government. And so, yes, psychologists and colleagues and any alliances that you can form, especially stakeholder groups and the media, getting the media on your side, certainly advocacy to affect change. I would say to the psychology community that you have to become an advocate. Someone said, who is an advocate for those with mental health problems and illnesses? Well, we are all advocates, but you also have to advocate for your discipline, or else you're going to die. In other words, if only the wealthy can afford it, and people cannot access psychological services, then the discipline might very well fade away as we know it. And furthermore, in terms of people being able to live lives of resiliency and wellness, I mean, it's very important that people are able to access psychological support services.
How do we end up with the PsyD? Yeah, well, it's a very interesting story. It started basically back in 1985, believe it or not, when we were first setting our legislation here in Newfoundland for the Psychologists Act, and we were a Masters Act then, and we hoped that in 15 years, in 2000, we'd have a doctoral program, and we put in a actually grandparent period for 15 years. 2000 came, we tried actually in the early 90s to get a doctoral program going for clinical psychology, and we're unsuccessful. We didn't have enough resources for it. 2000 came along, and we were reverting back to a Masters Act in our legislation. So what happened was essentially the government went to our president of the university and said, well, we need to reinstate the master's clinical program or something else. And our president then, Axel Meissen, said, well, we should look at an alternative to the PsyD concept. So actually there was a feasibility committee that was put together, government, university, community people, who after consideration said, yes, the PsyD would be our best option here at Memorial.
It began with one of the heads of the department, Dr. Abe Ross, who is actually a former CPA president, really thought that a PsyD would meet the needs of Newfoundland. We, at that time, didn't have a clinical program in psychology, and there was really a shortage of clinical psychologists. And so this was something that was really important to the community and the province. And so Dr. Ross got together a group of psychologists from our department, the Department of Psychology, as well as the University Counseling Center. Education at that time was also involved, and Eastern Health psychologists were involved. That's the health authority in Newfoundland. And the Association of Newfoundland Psychologists, which is the Association of Psychologists. And we put together a committee and began to talk about what the curriculum would look like and the feasibility of developing a clinical program in the province.
The PsyD program was an initiative that was really envisioned quite a number of years back, and Eastern Health and government were very supportive of it from the get-go. Way back in probably the early 90s, Memorial did have a clinical psychology program that folded. And after that time, Eastern Health began to have a number of recruitment issues for psychology. We had probably at times a 20-25% vacancy rate ever since there was no longer a program in the province to train clinical psychologists. So Eastern Health certainly had discussions with the Department of Health about workforce planning and where we could go from here, and subsequently had discussions with the university around what can we do to bring back a clinical psychology
degree program so that we wouldn't have the same vacancy rates and the same lengthy waiting lists for psychology services in Eastern Health. We've had situations where some clients with significant mental health problems have had to wait up to a year or two for services, which is certainly not in anybody's best interests.
We had some struggles starting out. When we officially launched the program, we also ran into a budget crisis. It was a budget crisis that we had not anticipated. It was one in which we were actually told by the university that we were not going to, after having admitted our inaugural class of students, that we weren't going to be able to take them because we didn't have the funding. So that launched a huge advocacy initiative. The students were instrumental in doing petitions. We had people from the community who petitioned government. We had some private partners come in. And the beauty of the way we structured our committee, the advisory committee, was that if one area got blocked, the other areas could come and bring their influence to bear. And in the end, we weathered that crisis and were able to admit our students.
And there were a number of frustrations along the way. Like I know, for example, there was one year in particular when myself, representing Eastern Health, and Jody Spiegel, representing the Association of Newfoundland Psychologists, met with 3 different health ministers because they changed so often during that year. And it was, so we would meet with one health minister and bring forward our concerns about psychology in the province and how we really needed to be training psychologists in the province. And 3 months later, there was a different Minister of Health. So there were some real challenges as we moved along.
The Association of Psychology in Newfoundland and Labrador has played an active role in the PsyD program's development from the beginning, and first helping to identify a need for the program with the closure of the master's program in 1993. And building a lot of community capacity through meetings with government and managers at Eastern Health, as well as raising the public's interest and support for the program. The most active role that we've played to date in the success of the program was during the crisis in the fall of 2009. So after the initial cohort of students was accepted and had begun their training, the university advised the administrative committee in the fall of 2009 that there was no secure line of funding for the program, and that for that reason we would not be accepting a new class of students indefinitely. This obviously did not sit well with the APNL for all the efforts we had put to train psychologists within the province. And we began a quite active campaign recruiting support again from our community partners. So at that time, we did recruit the support of a very famous local advocate, the president of and founder of the Eating Disorder Foundation, Newfoundland and Labrador. He used his resources to meet with the higher-ups at the university and at government. We also, the APNL, were able to write letters to different people within the university structure, going right up to the president of the university, down to the departmental chair for psychology. We were able to have conversations with different key individuals in the departments of health and education in the government. We also were able to have interviews on the radio and worked collaboratively with the students to ensure that there was a large public knowledge for what was at stake if the program didn't continue. The Canadian Psychological Association also came to our support at that time. So it was a real community mobilization, the 360 mobilization, and APNL was well positioned to recruit everybody for that.
I think that the first challenge from a student perspective in terms of this advocacy role was a pretty big challenge for us. As far as we knew, we had been accepted to a doctoral program that we were all pretty excited about. And in the end of July, we got an email from the head of the psychology department telling us that the program might not be going ahead in September when we had planned. Rather, it might have to be delayed a year or offering us various alternatives. that was quite a shock because a number of us had made some pretty big commitments to coming to the program and committing to this 4-year doctoral program. So we got the email individually, and we requested each other's emails to be able to communicate with one another. And the biggest challenge was coming together, 6 students who had never met, we didn't know each other, all fighting for the same goal, which was to pursue this program that we felt really passionate about, something that we really wanted to do. And what could we do as students? What could our role be to say, okay, hang on, we really want this, how can we facilitate it? So within 24 hours, we had communicated with each other as well as reached out to various different organizations within the university, within the government, basically whoever we could think of, to say what's going on here. And we got an email the following day from the Dean of Sciences saying that our cohort were guaranteed the program. It would be starting in September, but they couldn't guarantee what would be happening with future cohorts. So that was our biggest challenge before we even met. As part of our student advocacy effort, we were asked to basically take on a role as students, which means we could reach out in a little bit of a different way in terms of the community outside of the university realm. So we started a petition with the support and with the help of various people and sent it out across Canada. The petition was basically stating the importance of a doctorate in psychology program in Newfoundland, particularly highlighting the importance of the mental health services that were available in Newfoundland, or rather, in some cases, the lack thereof. So really kind of highlighting that and what the program had to offer. And that petition, like I said, it was sent across Canada and got support from students, from prospective students, from people in government, from people at the university, from really important people in terms of psychology and the psychology movement across Canada. Got a lot of buy-in.
That was kind of the 11th hour. What happened was the funding was stopped. There was no funding. The program moved through Senate and signed off by the Board of Regents, but there wasn't really that commitment to funding that we had thought there was. And here in Newfoundland, there was some discussion between the government and the university as to, how much each was going to pay and who was going to pay for it. And as a result, there was they stopped the program there for a minute, but it was amazing. The entire community of psychology, but as well as the university faculty, the university students. There was a huge petition signed by the university students that really was amazing and pushed government to make some changes. The MUN Student Association really put a lot of pressure on the government and the university, the higher administration in the university. This went right up to the president of the university. As well, the Association of Newfoundland Psychologists did a lot of advocacy for us, as well as Eastern Health. And that was really helpful because particularly Eastern Health was very used to dealing with government and advocating in government, had a lot of key people who understood how government worked. And certainly our upper administration, the Dean of Science and so forth, had a lot of experience in government, but it was nice to get that other side because we're funded through education because we're part of the Faculty of Science. And so it's a bit of a challenge. It would be a little easier if we were funded through health, but we're not part of health. So it was really good, the pressure that was put on and that voice that came out so strongly in terms of the need of psychology, clinical psychology in the province. And that really was the difference. And our first year cohort of students were just really amazing representations of us. They did a lot of radio, they got the petitions going. They were, great advocates. We were very fortunate. We chose well and we were very proud of them.
Vince Withers, who is the chair of the Eating Disorder Foundation of Newfoundland and Labrador, has been a tireless campaigner for eating disorder issues in the province, but also for the need for psychologists. And my area of clinical practice is eating disorders. So I'm connected to the foundation. And when in fact, I sit on their board. When I raised the issue to the board that this program was shutting down after just starting up, he had huge concerns about that. And he had the concerns from the perspective of being a representative for families and parents of individuals who are suffering with eating disorders, and from the perspective of co-chairing the Mental Health Advisory Committee with government. And he recognized and pointed out in letters and in meetings with the president of the university, the Minister of Health, that this was unacceptable to close this program down, and that he was speaking from the perspective of a person who has had a child with an eating disorder and works with other families who are suffering with eating disorders and other mental health issues. So he had a very powerful position from my perspective in terms of convincing both the university and the government that this is something that the people of Newfoundland and Labrador want, and not just the psychological community or the psychology community within the province, for whom you could argue it is self-serving. For Vince Withers and the people he was representing, this is clearly not self-serving. This is something that they see as being really critical to the mental health needs of the province. And there continue to be challenges. So the program is running on a shoestring in many regards. There are not a lot of faculty to provide the teaching and the training. We have a group of highly committed psychologists in the community who pull together to help teach the program, which is fabulous. But one of the faculty members is going on sabbatical. That happens every 7 years. You can go on sabbatical and then you're not there to teach. And what happened when that individual went indicated that they were going on sabbatical is we didn't have enough faculty to teach the program. So the program was going to be shut down for a year, not accept any new students, which of course affects the ability of the program to be accredited, and it means another gap in terms of students. So Eastern Health, which is the organization that employs psychologists, indicated their consternation about that it means that there's a gap, that they won't have psychologists to hire that year. There are numerous vacancies in the province, and so they went to government, and again, government, expressed their concern. Vince Withers expressed his concern, and we have found a way to take students in for this upcoming year. So it continues. The involvement of a variety of players makes it a very, very strong program that means that it is impossible for the university. And I understand the university's need. I mean, they can't offer a program if they don't have enough people to teach it. But it means that the university is not in its silo making its decision and nobody responding. As soon as a decision is made, there's lots of response. And that makes the difference between the program, I think, continuing versus being cut, because you can't cut it easily. It has impact, this program. What we're finding now that our first class is out doing their residency and internships, which is the year-long program that they have to do, is that these psychologists are unbelievably well trained. And everybody's recognizing that. So it's been a success. These students are doing really well, and they competed for internships across the country. 20% or more of students don't get internships. All of our students who were applying got internships, and most of them got CPA-approved internships, which is a real coup. That speaks to the quality of the students that we're producing.
I think perseverance and persistence were key, and it really was wanting to work together, wanting to move forward and see basically how this effort could have ripple effects on everything in the future. So the people who believe in this program are people who believe in psychology, who believe in the mental health profession, who believe that it's something that's really important, particularly in Newfoundland, and could see that this wasn't just a program. This wasn't just a cohort. This wasn't just a new academic endeavor. This is actually something that's going to have much farther reaching effects. And I think that everybody saw that coming into it, and everybody really supported it. And I think that that perseverance and that belief was really something that added fuel to the fire when it really felt like the fire was going out. And I think that that's a really key important piece, is recognizing just that belief.
It's nice that we can be a part of this celebration of advocacy for CPA, and I think that it's timely. We are one of many, what I hope will be success stories for psychology as we move into doctoral education and training and expand our scope of practice across this country.